just a big week for our city and for our community with the drive-through wrapping up today. And I think we have some good news just within the hospitals as well as far as numbers go. Kristen, do you want to go over the numbers for the hospital real quick, and then we'll go over vaccinations?
Absolutely. So the numbers in the hospital at Medical Center today are 68. We have 1 from 4 East, which is our postpartum unit, 1 on pediatrics, 21 on 4 Central, 24 on 7 Central, 20 in critical care, and we have 18 on ventilators. The list is still pretty long on those that we are carrying from the region. We have 1 from Wink, 1 Andrews, 1 Crane, 1 El Paso, 1 McCamey, 1 Pecos, 2 from Midland, and 2 from Fort Stockton. Do you want me to go ahead and jump on over to a vaccine update, Trevor?
Yeah, let's go ahead and do a quick vaccine update since we completed all that today.
Okay. In regards to employees being out of work, we are down to 13 employees that are out on COVID protocol. So employees are really doing very well as far as having to stay at home with their families. We did finish up vaccines today. In the last 5 days, we have vaccinated approximately 8,000 people. So we've really done a lot of our community. So great job on all your patients. We really appreciate everything. We're going to continue to run clinic with another dose of vaccines that we should be getting on Monday. So we'll be planning clinic next week, Wednesday, Thursday, and Friday. That is the 3rd, 4th, and 5th from 9 in the morning to 3 in the afternoon. We close the gates at 2. So I would really encourage everybody to be lined up early. And we are seeing a little bit of a downturn at lunchtime. So that really seems to be a good time to get in line. And our average time for a vehicle to get all the way through the process and back out to work is 45, 50 minutes. That's really kind of the longest times that we've been seeing over the last couple of days. Continue for your support on volunteers, donations. We really appreciate all of that stuff. Everyone has been wonderful in the community. Lots of compliments coming through the line. I cannot thank the volunteers that have come out here enough, Trevor. Those people have gone through every season. It gets hot, it gets cold, it's windy. So especially this morning at 30 degrees outside, these people put on some hand warmers and they have done an amazing job for our community. So thank you more than we can ever tell you today. If you want to volunteer, please jump onto that volunteers website and sign up for that. If you work for any of our organizations at Medical Center or ORMC, we're taking volunteers as well on our list so that we can make sure to get clinical people out here to take care of those patients that come through. But other than that, Trevor, I think we're good to go. I just can't say thank you enough. And if you want to help and be a part of this movement, we would be happy to have you guys next week.
Perfect. And I just put that in the chat box. That's volunteers at odessa-tx.gov. So that would be the email to send to. All right. Big news. Thank you, Kristen. Thank you to your team and getting this organized. It was an incredible experience out there the last 5 days, and I know it'll continue next week as we roll this out to the community. Stacy, do you want to give an update on the ORMC numbers?
Yes, thank you, Trevor. To date, Odessa Regional has tested 10,279 individuals. 2,174 of those are positive. In terms of our census, it's just a few from what we reported on Tuesday. We have 19 today, with 13 of those in the ICU and 7 of those on ventilators. 7 or 36% of our patients are from outside of Vector County. We have patients here from Alpine, Fort Stockton, Kermit, Levelland, Big Spring, and Colorado City. In terms of our staff who are either out on quarantine or self-isolation, that number is 6. So again, a very manageable number for Odessa Regional. For Scenic Mountain and Big Spring, today we have 5 patients in-house. None of those are on ventilators or in the ICU, so that is really good news. And we only have 3 staff out on quarantine or self-isolation at Scenic Mountain. That's all I have, Trevor.
Yeah, thank you, Stacy. Dr. Saravanan?
So just wanted to say a couple of quick thanks. One is thanks to Midland Memorial for the shots that they offered to the Big Spring community. I had told you guys earlier, there was 133 vials, which you can pull out almost 800 shots out of. So we were able to pull out the shots and give it over the last 3 days. We have given a total of 750 something. I'll have to look up the exact number. And the Big Spring community is very thankful for that. Scenic Mountain Medical Center's vaccination clinic staff did a fabulous job. I think yesterday we went through about 460 of those, kind of similar to the Ratliff idea to be vaccinating people in the cars. So it's working very well, and hopefully we will get more reallocations to that community to serve Big Spring and the surrounding communities. Second, thanks to Medical Center. Hopefully next week we'll get some shots reallocated from them to ORMC as well, and we can continue to serve different aspects of the community that aren't able to get to the Ratliff Stadium. So we look forward to that continued partnership, and definitely looking forward to giving those to our community next week. Odessa Regional got an allocation of 100 shots for next week. We asked for 2,000, they gave us 100, but we'll add that 100 Moderna to whatever Medical Center also reallocates, and we'll see where how much of the community we can get to with that. That's all I have for now, Trevor, unless anybody has any questions.
It's good you brought that up too, and we had sent a press release out yesterday as well regarding reallocation. We're all working together with all the hospitals around the region, Midland helping out, Big Spring, Scenic Mountain Medical Center has deployed 1,500 of their vaccines out. I think 500 went to Rankin County Hospital, 500 went to Pecos County Memorial in Fort Stockton, 250 went to Winkler and Kermit, and 250 went to Ward Memorial. And I know Sanderson got some help out from Fort Stockton. They were sent 200 as well, because there had been 0 vaccines down there in Terrell County and Sanderson. So everybody's helping each other out as best we can and trying to get this deployed to not only Permian Basin, but all of this West Texas region, since some of the areas aren't seeing any vaccine allotment. So we'll continue to work with each other. And I know when we get weekly vaccines, Russell and Kristen will figure out where we're sending, a certain allotment to hospitals. The more the better. So it's good to see everyone working together. Looks like Dr. Janaidu has just joined us. Sir, did you have anything you'd like to add? I think you're muted, sir.
Yes. Can you hear me now?
Yes, we can hear you.
Yes, like I said, I want to echo what you said about everybody working together. And I think it helps when we put our hands together and for the sake of the community. From the health department's point of view, our staff partnered with DSHS, and we helped with some assisted living facilities in Midland. I mean, the staff in Midland helped us, and we partnered with them to do some 30 at the courtyard assisted living facilities, and we vaccinated 30 residents and staff. And today we also partnered with DSHS and did the Lincoln Tower retirement, and we were able to give 70 vaccines. And we are still working on future partnerships with DSHS, and so that has been something that we appreciate, working together, with whatever, and whoever we can work with for the sake of our community. And of course, we completed the doses that we received for the community that we were able to give to the community within the past 2 weeks. Other than that, we are just doing business as and continuing along with the other aspects of public health.
We also have the mayor joining us as well. He's on the phone. Mayor, did you have any words you'd like to add before we get to media questions?
No. Basically, just wanted to come in here, continue the updates. I've been getting updates from our IC command and the city manager. Just basically want to continue to commend the amount of vaccinations that were distributed. and then just basically looking for the second round coming next week.
All right. Thank you. Appreciate that. We'll go to the next questions now. And first one I see up is Mr. Danny Barrera from DRB Media. Go ahead, Danny.
Yes, Kristen, if anyone wants to, if someone needs the vaccine that falls in 1B, but their schedule is pretty tight, what do you recommend? Will they be able to get it from their medical provider?
So some medical providers are getting vaccines, but not a lot at this point in time from what I'm understanding. We will be doing some Saturday and Sunday clinics towards the end of February. So that way we can hit some of those people that can't make it out here between 9 and 3 as well. And then of course, after we're done with the Ratlip project, probably the end of February, we'll be rolling all of the vaccines into our urgent care clinics. And that way we have many sites for people to go to for 12 hours a day instead of just Ratlip.
So, and is it still free of charge?
Yes.
Okay. All right. That's all I have.
All right.
Thank you.
Yeah, thank you, Danny. Up next, I see is came out yesterday, Mr. Mitch Borden, Marfa Public Radio.
Hey, y'all. I don't really have anything today, but congrats on getting all the vaccines out this week. It was really fast.
Awesome.
Thank you.
Thank you, Mitch. Up next is Odessa American. I see Mr. Federico Martinez. Go ahead, sir.
Good afternoon. I hope everyone's doing well. I know everyone's been working really hard. Great job out there, city and the hospitals and healthcare workers and volunteers. Great job. I just want to clarify something. We're getting a lot of confusion on social media. First few people that I talked to on Sunday were saying that they were being told to come back next month to get their second dose. But since then, I've been hearing people say no, that now they're being directed to go to the clinics. And so I want to make sure it is the clinics that they're supposed to go to, correct?
So all
For their
second doses from our Ratlip Stadium operations start on February the 14th. And those will all go to one of our urgent care clinics. They are set up to take second doses. So it's just a matter of what we are going to roll out with Trevor either tomorrow or Monday to say, here's the schedules, or you don't have to schedule. So we'll be sending that plan out to all of you, probably at the latest, the first of next week, but it will be in the clinic for second doses.
So we want to make sure to tell them, don't go back to don't go back to the stadium for that second dose.
That's correct.
All right. Thank you for clarifying that. That's all I have.
Thank you, Mr. Federico Martinez. We appreciate that. Let's see. Up next, I think we only have one left from what I see. And last but not least, Scott from CBS 7.
Hey, everybody. Kristen, real quick, asking for a friend who was in line today at 1 o'clock and got told, hey, we shut the line down. Was that just because the last lot ran out today?
It did run out today. So we should get our next shipment of the 3,900 on Monday, and then we'll begin rolling those out on Wednesday.
Very good.
So that is the reason that we turned them away today.
9 to 3, Wednesday, Thursday, and Friday.
That's correct.
Okay, cool. Dr. Saravanan, some science questions for you. And I wanted to talk about the variants. Are the tests that we take set up to recognize these different variants that are starting to pop up?
Yes, Scott. So we've gotten asked both about the tests as well as the vaccines. For the tests, they are PCR tests. They do test for any form of COVID. Any variant of that COVID virus will be caught by those PCR tests. For the vaccines, we now have confirmation that both vaccines that we have will still continue to work. Remember, the variants are basically mutations in the virus that change certain proteins. So the spike protein against which the Moderna vaccine is, and the spike protein against which the Pfizer vaccine is, neither one of those have changed. So those vaccines will still work as well. The PCR is more generic. It is not looking necessarily for just one of those spike proteins. There's a different receptor that's looking for, and that has not changed either. So yes, the PCR will catch all of those variants.
Are any of these variants meaner than the original bug?
Yes, by meaner, if you mean if they're more infective, they spread quickly, they can cause more severity of illness. Yes, each of the variants, that is what a variant is. It's the virus's way of mutating and adapting to becoming more virulent. That's what we call it. So it's their way of upping the game, and that's what the viruses do on a regular basis. And we do what we can to keep up with their mutations.
Pretty smart bugs. That's all I have. Thank you.
Thank you, Scott. And I just wanted to clarify again for those joining again, if you received your first dose at Ratliff, you will go to our urgent care clinics for the second doses, and we will be sending out that schedule and how to approach that setting that appointment up here in the coming days. So don't show up at Ratliff for a second dose. We will be doing these drive-throughs through February, so we don't want people to show up for the second dose. But
Trevor, I did have one more additional comment to Scott's
Okay, go ahead.
question. I figured I should say this, and it's about the genomic sequencing. So the PCR tests is testing you to make sure that whether you have the virus in your system or not. It's not looking for a variant. It's just looking for the coronavirus itself. There's a special test called genomic sequencing. And right now, those tests are being run only by the CDC. So the CDC samples part of the positive tests that we have in our country and does a genomic sequencing. Genomic sequencing identifies the variants of the coronavirus. That's not routinely done. The PCR is just looking for the virus generically. It's not looking for the specific variants. We're hoping that there will be more genomic sequencing done in the US because that'll help us identify the variants quicker. Right now, we wouldn't know if that variant is in our community until we see one of those things that Scott asked about. Is it a smarter virus? Is it spreading faster? Is it causing more illness? Then we start to suspect, oh yeah, one of those variants could be here. But we're not routinely testing for that because not every test gets genomic sequencing. The CDC only takes a sampling. So we're pushing for more genomic sequencing to take place so we can identify those variants early.
Thank you, Dr. Saravanan. Appreciate that. I know a lot of people have had questions about these different strains. Wanted to remind everyone as well, now that drive-through will be next Wednesday, starting next Wednesday, pre-register if you can. It will save you a few minutes in line. And if you pre-register, make sure you pre-register 24 hours before you go out there. It takes about 24 hours for that information to process. So if you happen to just pre-register while you're in line, that information might not be ready by the time you get to the gate. So just pre-register a day ahead before you come, and that will make it for a much smoother and efficient process. So we thank everybody for coming out. We thank everybody's patience and everybody, all the volunteers, really, to standing out there in all that weather for these last 5-6 days. It was cold. Chris says it was really, really cold, but nobody complained. They all did their job. We're happy to be out there, and I think the public was happy with the efficiency and how smoothly everything went. So Russell obviously is not with us today, but wanted to go ahead and finish out with a verse here. And I think the theme of these vaccines and what we're seeing is I always go back to hope, and it's giving us hope again that maybe we can return to the normal way of life we remember before COVID hit. So this comes from Isaiah 40:31. But those who hope in the Lord will renew their strength. They will soar on wings like eagles. They will run and not grow weary, and they will walk and not be faint. And I think all the people that showed up out there this week were soaring on wings like eagles. They were not weary. They were walking. They were not faint of heart. They were strong, and to get this done for the community. So we thank everybody, and we will be back on Tuesday for the next press conference, and then the drive-through kicks off on Wednesday. We'll see you guys then.
Thank you.